My name is Teresa Scheidler Hildebrand, and I'm one of several district nurses that service the students and staff of Canyon School District. We understand that sometimes your classroom may look more like a medical clinic than a school. And we also understand that at some time during your career, you may have students with medical needs that you or another staff person will assist with. One condition that has become more common with our students is a gastrostomy tube, or more simply, a G-tube. In this video, you will learn how to care for a student with a G-tube, how to feed through a G-tube, and how to administer medications through a G-tube. You'll also learn how to vent or burp a G-tube, and you will learn what to do if a G-tube comes out. So let's get started.
A gastrostomy tube, or G-tube, is a silicone tube placed into the stomach through a hole in the abdomen made by a doctor. These tubes have internal and external bolsters to help secure them in place. G-tubes are needed to give formula to a student who cannot consume enough food by mouth. By giving formula feedings through a G-tube, the student can receive enough calories to allow their body to grow at a normal rate. They can also be used to give medicines and to vent or burp the stomach. There are many types of G-tubes. When initially placed, they are a long, single-unit tube, but are often later replaced with a button. A button is a small G-tube with a detachable extension segment that connects through the center port for the feeding, and then removed when the feeding is completed, if desired. This allows the student to be active between feedings without fear of pulling on the tube. Always wash your hands before and after handling a G-tube. When providing a feeding or other G-tube care, inspect the site for any signs of redness, drainage, or skin breakdown. It's important that the skin around the G-tube be clean and dry. Some G-tubes will have a gauze dressing at the site. Others will not. If there is a dressing that's become soiled, consult your district nurse on how to replace the dressing. If the dressing is to be replaced, the parents will provide the extra supplies. Some G-tubes have the extension tubing attached and taped to the skin, or pinned to the student's clothing to prevent the tube from being dislodged or pulled out. While the extension tubing is designed to be detached from the button, many parents prefer the extension tubing remain connected. Attaching and detaching the extension tubing is a simple step. On the end of the extension tubing, you will notice two things: a circular arrow pointing in a clockwise direction, and a mark on the top of the adapter that aligns with the tab on the side. A corresponding mark and slot is on the face of the G-tube button. If you need to attach the extension tubing, open the flap on the button. Line up the end tab of the extension with the slot in the button and insert it into the slot. Then rotate the tube clockwise in the direction of the arrow. Always check to be sure the extension has been securely attached. To remove the extension from the button, simply rotate the extension counterclockwise until the markings line up. Then, detach the extension and close the flap. Remember to keep one hand on the button to prevent pulling it out. There are two ways to deliver a feeding by G-tube: bolus and continuous. Bolus feedings are administered over a short period of time by using gravity. Continuous feedings are administered using a small mechanical feeding pump. Whether by gravity or by pump, remember the following. Always start by washing your hands. Then collect your supplies. All extension or pump tubing should be primed before attaching it to the button. This prevents large amounts of air from entering the stomach. To do so, attach the syringe to the extension. Fill the syringe or pump bag with formula. Unclamp the extension. Infuse enough formula or water to fill the tube. Then reclamp. The student should be in a comfortable sitting position for the feeding. Another acceptable position is to have the student laying on his or her right side. This will help to empty the stomach. If the feedings are given too fast, the student may feel cramps, including belly pain, retching, or vomiting. If this occurs, simply clamp the tubing and give the student a few moments to calm down. When ready to resume, remember to do it slowly. We encourage school staff to talk to the student during feedings and to provide positive associations and social support with each feeding. The extension tubing is clamped when not being used to prevent formula and gastric contents from coming out of the tube. If the extension tubing is detached between feedings, the G-tube button should be kept using the end plug when not in use. Feedings given by gravity over a short period of time are often called bolus feedings. To deliver a bolus feeding, assemble your supplies first. You'll need formula, the extension tubing, a catheter tip feeding syringe, and room temperature water for flushing. Once you've assembled your materials, wash your hands. Shake the formula can to assure that it is thoroughly mixed. Connect the syringe snugly to the extension tubing and make sure the tube is clamped. To prime the tubing, hold the end of the extension over the sink or cup, or simply at the level of the syringe. Pour a small amount of either water or formula into the syringe. Unclamp and prime the tubing, then reclamp. Connect the tubing to the G-tube button. While securely holding the button with one hand, gently check to make sure the appliance is completely connected and won't fall off during the feeding. Hold the syringe at the level of the student's stomach. Fill the syringe with formula. Then, open the clamp to begin the feeding. The rate at which the feeding infuses is relative to the level of the syringe. Raising the syringe will speed up the flow. To slow the feeding down, simply lower the syringe to the desired level. The feeding should be delivered over 10 to 20 minutes. Formula may come back into the syringe if the student is fussy, agitated, excited, or coughing. Clamp the tubing until the student calms down. Once they are calm, you can unclamp the tube and allow the feeding to continue. If the extension tubing fills with large amounts of air, simply lower the syringe and allow the air to flow back into the syringe. At the end of a feeding, the G-tube should be flushed with at least 5 to 10 milliliters of water, or as indicated in the feeding orders from the doctor. This helps prevent the tube from plugging up. When the feeding and flush is completed, clamp and disconnect the extension tubing from the button. Then close the flap on the G-tube button. Supplies used for G-tube feedings are reusable and must be clean in between feedings. To clean the tubing and syringe, simply rinse with soap and warm water. Once thoroughly rinsed, hang them to air dry. Finally, wash your hands. A feeding delivered through a compact, lightweight, and portable mechanical pump allows for it to be delivered over a longer period of time. Feeding pumps provide a certain level of privacy, while allowing greater flexibility for the student when participating in a variety of school activities. They are attitude independent, which means you can tip it and turn it, and the pump will still work. To deliver a feeding using a mechanical pump, you'll need a feeding pump, bag and tubing, and formula. Once you've assembled your supplies, follow these steps. First, wash your hands. Make sure the formula is thoroughly mixed. Open the feeding bag and gently separate the sides of the bag. This will allow the formula to be poured freely into the bag without spilling out the top. Before closing the bag, make sure to evacuate as much air as possible. Then securely close the cap. As with bolus feedings, the tubing will need to be primed to avoid infusing air into the student's stomach. To do so, first remove the protective adapter cover from the end of the tube. To prime, gently pinch the teal-colored tubing marked by the symbol of a drop, while gently squeezing the bag to help with the flow. When you pinch, you will feel the inline occluder inside, a specialized valve that controls the flow of formula. A gentle pinch moves the tubing away from the occluder, allowing the formula to flow. It is important to pinch gently and just below the symbol of the drop to avoid damaging the occluder. To load the cassette, open the door on the pump. Place the teal tubing around the pump wheel and stretch it slightly to fit the cassette into the receptacle. Now, close the pump door. Make sure the tubing doesn't become pinched in the door. Press and hold the power button to turn the pump on. The alarm you hear is the system testing itself. When the pump self-test is completed, you will see the rate at which the pump was last programmed to run. Unless otherwise instructed by your district nurse, you will not need to change any of the settings. To finish priming the tubing, hold the end of the tubing over a receptacle, then press and hold the prime key until the formula has completely filled the tubing. When priming is completed, release the prime key and replace the cover on the adapter end. Special backpacks designed for feeding pumps allow for the student to receive their feeding while participating in school activities uninterrupted. To load the pump into the backpack, place the formula bag in the innermost compartment of the backpack by securing the Velcro strap around the neck of the bag. Secure the pump with the Velcro straps in the next compartment as well. Zip up the pump compartment and then the formula bag compartment. Be careful not to pinch or damage the pump tubing. Once the pump and formula bag have been secured, place the backpack on the student. Connect the pump tubing securely to the G-tube extension. Then open the clamp. Open the outer compartment of the backpack to access the pump. Press and hold the on/off key to turn the pump on. Check the infusion rate to assure it reflects the doctor's orders. Then press the Run key to start the feeding. Assure that the feeding is infusing by observing the dripping icon. Please note that depending on the pump used by the student, it may look different than the one here. Even so, it will operate the same way. Your district nurse will instruct you in the operation of your student's particular pump. When setting up a pump feeding, make sure the tubing is neatly stowed inside the backpack so as not to create kinks or loops that can get caught. This applies to students who are either ambulatory or not. Using caution with the pump tubing helps to prevent pulling out the G-tube accidentally. Always remember to wash your hands when finished. Some students with a G-tube can burp on their own to relieve excess air in their stomach. However, some cannot. When this happens, you can help release the air from their stomach using a procedure called venting or burping. To vent a G-tube, you'll need a cath-tip syringe attached to an extension tube. Connect the extension to the button as previously shown. Then unclamp the tube. The excess air will bubble up into the syringe. It's not uncommon to see formula or stomach juices also flow into the syringe. It may be helpful to assist the student by credaying or pushing on the stomach to expel the air. Once the air is removed, allow any excess formula to flow back into the stomach. Then clamp and disconnect the extension tube and replace the button plug. Finally, rinse the tubing and syringe with warm water and allow to air dry. Liquid medications can also be given through a G-tube. Some extension tubes will have two ports: a larger main port for infusing the formula or water, and a smaller secondary port for administering medications. If the tube has this second port, you must make sure the feeding port is closed or the pump is paused when using the medication port. To administer medications through the G-tube, first, clamp the extension tubing to avoid leaking of formula from the stomach. Then put the medication syringe into the secondary port. Unclamp the extension tube and slowly administer the medicine. Once the medication is finished, reclamp the tube, disconnect the syringe, and close the port securely. Don't forget to unclamp the extension before resuming the feeding. If the student is receiving continuous feedings with a pump, it's not necessary to flush the tube with water. Allow the pump to deliver the medication along with the formula. Occasionally, a G-tube will accidentally come out of the stoma or hole in the skin. This is an urgent situation, but not emergent. The G-tube must be reinserted in the stomach before the stoma closes. If the G-tube comes out, cover the stoma with a dry dressing or bandage. Immediately notify the student's parent or district nurse. If the parent or district nurse is unavailable, contact an emergency medical provider or 911. School staff should never attempt to reinsert a G-tube. Only a trained parent, nurse, or EMS provider should reinsert a displaced G-tube. If the parent has provided an emergency gastrostomy replacement kit, hand it to the nurse or EMS provider.